Hello and a warm welcome to all of you, dear friends, for this next session of our Heartfulness Wellness webinars. I'm sure you must have attended our previous webinars in which um, we have tried to come up with topics which are relevant for the wellness of various sections of our society. Right now, as you know, this is September and we are celebrating our month of pediatric cancer awareness. And that brings us to the today's topic, which is addressing pediatric cancers. Coming up with awareness, coming up with um, more sensitivity in the overall population amongst all of us about what pediatric cancers are all about, the challenges faced by the children and their families, and how the medical fraternity as a whole and the society can take a step to ensure that we have something to offer to these children and these families. The theme for this month is Cure for More and Care for All. And I am sure each of us, in our own small ways, can take a step forward to do something about it. I'm really happy because today I have with me Dr. Rishikesh Chavan. It is a uh, it is an occasion of special happiness for me for two reasons. One is because of the work that Dr. Rishi Chavan is doing in the field of pediatric cancers. And second, and something very deeply personal, is because I have some very fond memories of spending time with Dr. Rishi when we were together in our medical school. It's almost 20 years back.
Yeah.
But today, when I meet him again, the memories are still fresh in my mind and in my heart. So, welcome, Dr. Rishi. And uh, a short introduction for the benefit of all of you. Dr. Rishi Chavan is a pediatric oncologist. He stays in California and currently he is a medical director of the bone marrow transplant and cellular therapy unit at Children's Hospital of Orange County, CHOP Children's. Dr. Rishi is a bone marrow transplant physician and he is taking care of children with pediatric cancers and other diseases which require bone marrow transplant. Dr. Rishi has worked as a faculty at Tulane University School of Medicine and Loma Linda University in pediatric hemato-oncology. The researcher that he is also involved in multiple clinical trials and translational research projects along with mentoring medical students and residents. In addition to that, on a personal level, Dr. Rishi for years has been involved with heartfulness meditation. I remember practicing heartfulness meditation with Dr. Rishi, and I can say that we share this common experience of being helped with a practice which has taken us along in our personal lives, in our struggles in medical school, residencies, fellowships, and further ahead in our career. I'm sorry for not introducing myself. I'll give a short introduction. My name is Dr. Gorakh Parulkar. I'm a cancer pathologist. I'm trained in oncopathology and right now I practice cancer and general pathology as an independent practitioner. I am also involved like Dr. Rishi with heartfulness meditation in multiple ways. and these shared bondings of having our medical school together as well as practicing heartfulness meditation together uh, gives me the joy of inviting Dr. Rishi again to our webinar. Welcome, Rishi.
Okay, welcome, Gorakh. So let me try and complete the introduction that you left it halfway. Okay, so like Gorakh said, this is really exciting to me to be here today because Gorakh was instrumental in me starting heartfulness meditation. If you mind, I might start with a story. We were both back in Sion Hospital in 99, 98. That's when I started med school in 1998 in Bombay, Sion. And we were living in the dorms, and there was a day when in the evening, Gorakh was sitting in his room, and the rooms are shared. So he couldn't, like the door was still open, like halfway, like a little bit open, and he was sitting with lights closed on his bed in a meditation pose. And I had the arrogance of going and waking him up and saying that, hey, Gorakh, is everything okay? Why are you sitting in your room with lights closed? And the gentle and the kindest person that he was, he didn't get angry or upset with me. He kind of basically said that, it's okay, Rishi, I'm fine. I'm just doing my evening cleaning practice, which is a part of my meditation practice. And so I felt embarrassed, and I kind of left the room, and I said, I'm sorry, Gorakh, please continue. And then that got me thinking. So what got me thinking is that Gorakh was already a year ahead of me in med school, and he had been the not only the top of his class in the med school, but also the top of the university. So I was like, this is a really smart guy. He's really humble, and he's doing something. I need to get in on the secret. So that's what got me interested in meditation for the very first time. What happened though is that my other roommates joined the meditation practice first. And when I asked them that, I really want to join this, they said, no, this is not for you. This is a little bit more serious. So I was even more excited about it because somebody's saying that meditation is not for you. I was like, okay, oh my God, if this is not for me, then I really need to check it out. So this is a short introduction. And, since then, Gorakh has been a guide to me in my spiritual practice and otherwise through the meditation, through the years and through my med school years. So I'm really glad that, we're doing this today. And the fate as it may be, he's a cancer pathologist and I'm treating children with cancer. So I think this is perfect. Okay. Thank you, Gorakh.
Thank you, Rishi, for your kind introduction. And one thing which I wanted to discuss with you, because this brings me a topic like as a pathologist, sometimes when we take up biopsies or we take up diagnostic uh, material, and it is really very, for whatever short time that we are in touch with the patients and the relatives, sometimes it is really challenging uh, to talk to them, to let them know on the diagnosis and even indirectly. And I can only imagine, like, for you to deal with them day in and day out for days and months together, uh, how do you manage?
So I think what you asked the most important question first, that, what happens is that when a new patient comes in or a child is suspected, even suspected of childhood cancer, uh, the hardest part is the waiting, right? You've done a biopsy, you've sent it to a pathologist like yourself, and then you're waiting for the answers. And then you sit with the family and you're going through scenarios. So based on the other information, like the labs and the symptoms and the clinical symptoms, you may have some idea and sometimes almost certainty that this is going to be cancer. However, you have to wait till the results and then, like, build up with the family. How do you speak with them? The conversation typically goes on for like an hour, hour and a half, sometimes 2 hours, such as 2.5 hours. And the studies have shown that when you're talking to a family this long, they're probably going to kind of retain only 10% of the information. So what it means is that you may have to have the same conversation 10 times. You go through different scenarios, But to me, the key thing is that the most important thing that gets communicated in that conversation is, this is not your fault. You yourself are a parent, I'm a parent myself, and there may be parents who are listening to this. And we see that in today's world, if you're a parent, the smallest thing that happens to a child, like even if they get a ear infection or if they get a scratch or something, the mom or the dad invariably may think that this is their fault. When a diagnosis like cancer happens, it is a life-changing, it's going to shatter their world. And at that time, they kind of gravitate towards thinking that, is there something that they did wrong? So the questions come up: is it because where we live? Is it because of the processed food that we eat? Is it because of is it because something that they did or did not do? So in that phase, I think the most important thing that an oncologist does is that he or she brings the family together and brings them to a point that, look here, this is what is something that has already happened. Cancer is a happenstance. It is an accident of nature. It is nothing that you did or did not do that caused the child to have cancer. And this is something that you may have to subtly repeat multiple times. And I think this is the most important message that I feel all families dealing with childhood cancer need to know. You could go into the science and the speculations about environmental factors, about individual risk factors. But again, at the time when a child is diagnosed with cancer, the family needs to come together. They need to build the strength to have the presence of mind. What next? So oftentimes I'll use the analogy saying that, look here, anybody can die anytime, right? Which is the truth, right? So I would say that, I may be crossing the street, get hit by a car, and I would die in that moment, right? So the point is that it is not like that's the elephant in the room, the fear of death. And the point is that it's not about dying. The fact that the child has a cancer means that we have the opportunity to do something. So kind of getting the family to a place that, accepting the diagnosis and then coming to a point that what can we do about it now? And really in today's world, the outcomes of childhood cancer have significantly improved to what it was 30, 40 years ago. When you think about childhood cancers less than 15, they're divided into three parts. 1/3 of them are leukemia lymphomas, 1/3 of them are brain tumors, and 1/3 of them are other solid tumors like kidney tumors or neuroblastoma or other cancers, osteosarcoma kind of thing. So when you think about leukemia lymphomas, which forms the big chunk, like 1/3 of the childhood cancer, the treatment outcomes are really good. We are achieving cure in almost 90% of the patients. The leukemia survivors are becoming more and more common. I know of a physician who had leukemia growing up, underwent bone marrow transplant, and then is now a physician taking care of children with cancer. I know of several nurses. I know of several nurse practitioners who've been kind of survived leukemia and now are working in the field. There's other people who work like as cancer survivors too. So kind of helping the family come to that moment, helping them alleviate the regrets or if any of the past, like bringing them from the past to the present moment, briefly talking to them about the future, that it doesn't mean that just because the child has a diagnosis of cancer, not everything is going to be bad. It's going to be different, but there is hope. Bringing that hope in the picture and then bringing them back to the present, like taking one day at a time. I think this is the most crucial thing that happens in that 1.5 hours of 2 hours of the conversation. I hope that answers the question.
It answers wonderfully. In fact, that reminded me of something that I heard in Oprah's show recently, in which he says that accepting something does not mean accepting it is okay. It just means accepting that it has happened.
Right.
Now what can I do about it?
Right.
So I think you have answered that wonderfully, in the sense that is one big challenge that you face of how to bring the families from their ideas of guilt and of denial and of questioning why it happened to accepting the diagnosis, and then having a positive mindset of what can we do as a family for better outcomes. Did I understand you correctly, Rishi?
Yes, absolutely. And one thing I want to say is that it is also helpful to take yourself out of the picture, because some families may come to that point soon, some families may take a longer time. So it is always important to remember that it is not about you, it is about the patient. you know uh, Sometimes we have teenage patients, the young adults. There the dynamics is much more different, right? Because teenage is an age where children are willing to rebel. They don't want to listen to their parents, they are trying to avoid authority figures. And then they're supposed to have a lovely life, they're supposed to go to college and kind of do all things. And then the cancer throws a monkey wrench in their life. So sometimes it's almost easy
Have we lost Rishi? Rishi, are you there? Rishi, are you there? Abhirami sister, can you come audible? Well, I think there was some connectivity issue, uh, but we are together again. So, Dr. Rishi, you were saying something about teenagers diagnosed with cancer facing some different challenges from the small children. So, can you
yeah.
please?
Sure. Sorry about the connection issues. They say the internet is the new electricity, but so what I was trying to say is that when you think about childhood cancer, there is differences when you're thinking about a child who's less than 7, 8, or 10 years old, and there's a difference when you're thinking about a teenager or a young adult. Here in the US, we treat up to 20, 25 as well. So because the young adult cancers are more akin to childhood cancers compared to the older adult cancers. So when you're talking to a teenager, the dynamics is different, because it's not that the parents need to agree, but also the teenager has a buy-in. And what I was saying is that when you think about the cancer, it's like almost like an interruption, right? Somebody's forcing you to take a break from what you're doing, kind of thing. And even if the outcomes are good, it's almost like that being able to adapt to that new lifestyle or new change is the biggest challenge. And so that's what I was saying, that with the teenagers, what I try to say is that I say that think about the strongest player that think about here in the US we say the football players, like quarterbacks or something, or strongest cricket player that like Dhoni or Sachin Tendulkar or something like that. And or I ask them, who's your favorite player or who's your favorite athlete, and then they'll say that who are like Sachin Tendulkar or whatever is their favorite athlete. And then I say to the teenager that you per se have more strength and character than the strongest player. And the reason I say that is because what you are going through and what you you are having to go through, none of the strongest players have had to go through. So the fact that you're able to go through this, like accepting the diagnosis, the treatment and everything, shows that you have the strength of character. So again, the same thing, bringing them back to the present and then one day at a time, and what's the next step kind of thing.
So over all these years, Rishi, uh, I'm sure you must have come across so many uh, different families and different children with unique responses, unique reactions. Any memorable experiences that you would like to share?
Sure. So it is almost every day or almost every week that you come across these experiences. And the challenge is, for the lack of better word, not to get addicted to those experiences, because that could be challenging too, right? But if I were to share some of those experiences, I think it's taught me a lot. It's made me much more of a humble person. I joke about it, but I say that, I can never really have a bad day, because if I have a bad day, then I know of several families who are having it worse than me. And so, whether you feel good or bad is very relative, right? Uh, so that's the challenge there. And I, again, as a joke, I say that, I can never really have a bad hair day as well, because most of my patients won't have their hair, as chemotherapy causes them to lose their hair. So about the experiences, I think what one of my patients, he was an immigrant from Mexico, and he was a little kid, and he used to speak only Spanish, and so we would have to use an interpreter talking to him. But there was something that he always said, like, when you walk into a room, like, you ask them, how are you doing today, how's your day been? Something that he was always said is that, bien gracias a Dios. And what this phrase means, and it's kind of etched in my heart, that, what this phrase means is that I'm doing fine, thank you to God. And this was a very young kid, like, he's probably 8 years old now. When I was taking care of him, he was 6 years old, and he was very polite. His parents were in Mexico, they were not living here, so he was living with his aunt, and he was here for his treatment. And for him to have that maturity, that, that he's doing good, but it is good because of God. And it's a simple phrase, bien gracias a Dios. So, I'm doing good, and I'm like, thank you, God, kind of thing. Thank you for, like, helping me be good. And his is a success story. He had acute myeloid leukemia. He went through bone marrow transplant. He had complications with infections before, but now he's doing fine. He's almost a year post-transplant, and he's back with his family in Mexico. And we still stay in touch, through telemedicine, and he's doing great. So that's a very humbling experience, right? And then there are some other experiences where, there was a couple, both of them were pharmacists, and the young kid developed cancer. And so they had to change their lifestyle completely because of that. One of them had to quit their job, and basically, uh, they had to bring in the grandparents. The grandparents relocated because of that. So my point being is that it's not just the diagnosis of cancer, it's also how it affects the entire family extended. And those are the experiences that teach us that, if these families can do it, we can overcome a lot of our simple challenges, if we may say. I was telling you earlier before we started recording, I just took care of a patient yesterday. She's a teenager. Her mom is trying to do two jobs to make sure she can keep the finances straight. And so when she brought her to the infusion center, she was sleeping, the mom was sleeping. And when I asked, she said she'd worked all night until 4:30 in the morning, and then driven 1 hour to bring the child to get treatment. So it's not just the cancer, it's the social aspects, it's the psychological aspects. And then there are some challenging experiences as well. There was sometimes the families and the teenagers, they have a tough time dealing with the idea of control, because when they go through bone marrow transplant, what happens is your immune system goes down completely to almost zero, right? And so you are constantly trying to tell them that, okay, you're not supposed to go out, don't go out in the crowds, something like what's happening now with the coronavirus. So the shelter in place is a lifestyle for patients who go through transplant forever, like, not ever in the sense, it's always been that way. So for those first 6 months or so, when they go through bone marrow transplant, you're trying to tell them that you cannot go to school, you have to avoid crowds, wear a mask, those kind of things, which now everybody has to do, strangely. So most of my patients are happy now, kind of, because they're already doing virtual school and things that we all are doing right now. But the challenge I feel is that once you have almost scared them into not doing those things, at the end of it, when they recover and their immune system comes back, pushing them or encouraging them to go back to school, go back to work, go back to the regular lifestyle, that's harder, because there is always that fear that, oh, what if my cancer comes back? There are these associations that families may have that, oh, when I was first diagnosed, I had a headache, and that's when I got diagnosed. So every time after that, throughout their lifetime, if they get a headache, they're going to worry if the cancer came back. Somebody got diagnosed when they had a bruise. So next time, even after the cure or having been treated, if they have a bruise, they worry, is the cancer coming back? So these are the different experiences that you learn from, and also you are able to share with the families that, look here, I know this is going to happen, and I want you to be aware of it. All the parents, I tell them that, this is not a one day thing. Like, I when I do the consent conference for bone marrow transplant, I say that the day of transplant is probably the most boring day of your lives. It is what happens before and what happens afterwards is what is important. Okay, and the reason is because they focus on the day of transplant, but before is the chemotherapy that they get, and after is the immune recovery. That's the big picture that they need to look at. And I'll tell the parents, both the dad and the mom, that at least one day of the week, you have to make sure that you provide time for yourself. You have to make sure that you go away, you are with your friends, you go shopping, or you may go watch the movies, or you go for a run, or whatever you do, but you are away from your child, and you are trying to take care of yourself. So I think that's a very important message, because think about it. You're talking to a parent whose child has been diagnosed with cancer. They're already kind of halfway blaming themselves for it. And then in the middle of that, you're requesting them to be able to take that space, that time for themselves. Just like we would say in an airplane, if the oxygen drops, you got to put your mask on first, right? Or this may be relevant even now with the COVID thing, that before you ask somebody else to wear a mask on, you should put your mask on first. So, so I think those are the interesting discussions that we learn from, and it keeps us humble all throughout.
Any specific themes, Rishi, that you have observed over the years, like some some characters that you see in the family, the children, which help them do better emotionally, socially, and medically? Anything that you think can help other families get some hints of how to go through it better?
So one of the key things is, Gorakh, that not all families do the same, right? Like, there are some families who struggle with it, and there are some families who are much better at it, right? There are some families who actually make it a celebration, right? They will, in their small towns, they'll have a fundraiser, or they'll have a kind of, a small awareness. Even with COVID now, even with the shelter in place restrictions, one of my patients, they had a car thing going on. Like, people drove around their house in cars and kind of giving that patient best of luck before she came for transplant kind of thing. So that's one end of the spectrum where they've not just accepted it, they've not only that they're doing what's needed, but they're kind of almost celebrating it. And I think that's one end of the spectrum. The other end of the spectrum is where they're still in denial. And the biggest challenge I feel is our personal, threshold to give up control. Because what happens is that, in healthcare today, if you were to summarize the most important challenge and the most important opportunity in healthcare today is the word trust. No matter where you go in the world, right? Like in India, we've seen, multiple scenarios play out where there is challenge of people trusting the medical profession, trusting the doctors, trusting the hospitals. And I'm not saying that completely wrong, because there's definitely some bad actors, but that trust becomes a challenge. In the United States or developed world, that plays out in the role of, malpractice, and that plays out in the role of malpractice insurance, that plays out in the role of the cost of healthcare, because additional tests being done to kind of make sure that you're not missing everything and trying to cover every practical aspect. So I feel like that for a physician and a family, the relationship between an oncologist and the family is quite sacred because of that trust. And then you want to build another layer on that trust is a layer of faith, right? So there is trust, there is belief, and there's faith. And so the reason I want to talk about faith is that if we go back to my patient who used to say bien, gracias, adios, right? So if you look at that phrase, it is not just like he was beyond trust, belief, because he was at the level of faith that there was a higher power, or there was something higher that was taking care of him. It's not just the doctors, it's just not just the medicines, it is something beyond all of us. And I think having that insight and at that age was kind of, it was awe-inspiring kind of thing. And so sometimes it's easier with the kids, but it's harder with the parents, because as we grow older, like now we are we are working professionals.
Yes.
Yeah, parents, and so our reliance on technology, our reliance on science is much more than a child's sense of wonder, right? A child will look at the moon and the stars and he would just have a wonder, right? Like we are, I don't want to say jaded, but but sometimes that ki haha theek hai, let's move on kind of thing. What's the big deal? So we lose that sense of wonder, right? But where I'm coming back to is that in the world today, let's say we're sitting across the globe, right? Like we're sitting across the globe, but technology has made it possible for us to do this webinar, and we can trust on technology, right? We can trust if I send you a message, a text message, I am almost 100% sure that you're going to receive it. If I send you a FedEx package, I'm 99% sure that you're going to receive it in the time that they say. What happens is that people extrapolate these advances in technology to medicine, where things may not be black and white, they may be gray, right? Especially when it comes to cancer treatments, especially when it comes to a relapsed cancer treatment or a high-risk cancer treatment. Because not everybody comes for bone marrow transplant, right? Like people that can be cured without a bone marrow transplant will actually be cured just with chemotherapy, radiation, and surgery if needed. But the people who don't will come to bone marrow transplant. So the cases that I see, the families that I meet, are mostly, even within the cohort of childhood cancer, are the ones that are dealing with a relapse or a recurrence where the cancer came back, right? Now, this puts another set of challenges, because they've already gone through one cycle of, oh, I trusted the doctor. The doctor said that if I'm going to stay compliant with my treatment, and because I was
think we have lost connection again. Yes, Rishi.
So
There was a break,
this,
but you can.
yeah, so Gorakh, this just proves the point where we were talking about that, our trust in technology is so much that we forget the aspect of faith. And the reason I wanted to bring this is that because, like you said before, it is acceptance doesn't really mean that you are accepting something because it is good for you. You are just accepting that something has happened. It may or may not be good, right? And what gives you the courage to be there is basically having some framework of some kind of faith in either, I mean, either yourself or your connection to the higher powers, or what it may be. And I don't want to kind of how to say, make it very uh, I mean, I don't want to be preaching something, but at the same time, I do see that the families who have the ability to come to that level of acceptance, who have the ability to zoom out of that small event and look at the bigger picture, those are the families that tend to do better, right? And even with the parents, that the ability to have a connection with yourself, and that's very important, because without that, the awareness that what you are doing may be affecting your child, or somebody else, is lacking. So we come back to the two key things, which is, one is awareness and second is acceptance. So with acceptance, the awareness increases, and then with further uh, awareness, there are more things to accept. And I think this brings people close to reality. And and I'm saying this in a very practical way. I'm not saying this in a philosophical way, because oftentimes there is a lot of decisions that need to be made. And in order to make those decisions, okay, the child is diagnosed with cancer, what next? Are we going to start chemotherapy tomorrow, or do we want to get a second opinion? How sure are we about this diagnosis? Now, that's just about the treatment part. Within the treatment, after you started the treatment with chemotherapy, there are other aspects to it. A child on chemotherapy, if they say that they're losing weight, okay, and there was one mother once, she was kind of very adamant, because after a certain point, if the child is not able to eat and are losing weight, what we do is we do total parental nutrition, which is basically trying to do nutrition through IV fluids. And this mother, she kept fighting with me. She said no, she didn't want total parental nutrition for her child, because and initially I kept arguing, or I kept kind of trying to convince, at a point where I was trying to tell her the benefits of the total parental nutrition. But then I had to take a step back and I see where she's coming from. So she's coming from a place where she wants some degree of control. She's not able to control whether her child is at home or has to be in the hospital. She's not able to control whether she goes to work or she has to stay with her child. She's not able to control whether the child gets chemotherapy or not. So the nutrition part and being a mother, that's her fine line where she says she wants to control. So taking that step back helped, that kind of sat down with her and kind of, okay, where are you coming from? So the thought process was that in one of the previous cycles of chemotherapy, the child had been treated with TPN, the total parental nutrition. And when they started the TPN, he absolutely refused to eat. So her fear was coming from a point where that if you start this, then we are kind of giving up. He won't eat by himself. And so I had to negotiate. I said, okay, will you allow me 2 days? Let us do this for 2 days and then see if he's still eating or not. If he's still eating, we'll continue. If he stops eating, then we stop and we agree with your plan. So I knew the child would eat because he was on steroids, and I knew that would make him hungry. So that was kind of something that I had in my back pocket, where kind of it worked out well. But my point is that when you think or you place yourself in the shoes of these families, and you cannot always do that because you want to maintain your objectivity as a physician. But if you place yourself in the shoes of the families, that's where you kind of understand where they're coming from. So to answer your question, the families that do well have a framework where they can tap into the bigger picture or some higher power, and go from trust to belief to faith, and kind of have that, the ability to zoom in and zoom out. And that's what we say is adaptability. That's what we say is resilience, because every day things may change. Today you are told that there is a 90% probability that the child is going to go into remission after X treatment. However, when we say 90% probability, there is still 10% probability that it may not work. So statistics don't mean much if it is your child, because it is either 0% or 100% if it's your child. And so kind of trying to say that there's nothing that you did wrong and this is where we are, what do we do from here on? I'm sorry, that was a long-winded answer to your question, but I think that's the key thing, the adaptability.
Yes. And how about yourself as a medical professional when you are dealing with uh, challenging emotional situations, unpredictable situations, taking tough decisions, many a times the results of which we do not, especially when it is dealing with small kids, especially when you are seeing families going out of the way and sacrificing everything else for that child, and then having to make decisions. You know what I'm saying?
Yes,
How,
yes, yes, yes.
how, what helps you? I'm sure it's not easy, and I'm sure you be having your own tough days. But how do you? Uh, what helps you balance in such situations?
So I want to go back to our days, since I started medical college, right? Like, so in Sion, Bombay. So if we go back to those days, I think definitely the practice of meditation has provided me with a tool to be able to deal with these things and see the reality, right? Like, so the way I see meditation is that I feel meditation is a tool to bring you closer to reality, right? And further help you with accepting the reality, right? And the reason I say this is because, not as a catchphrase, but a lot of how do you say, as a physician, your role is first do no harm, right? You want to make sure that you are not causing anybody any harm. That's the most important thing as a physician, right? Do no harm. And I want to extrapolate this to not just physicians and us, but I want to extrapolate this to the general population, because oftentimes you, in the general population, you have people who know somebody who has cancer. And I've been in that place too, where maybe my family members have gone through cancer treatment. There are near and distant family members who've gone through cancer treatment. And so how do you kind of deal with that? Like, what should your role be in that? Let's say somebody listening to this webinar, there's not a childhood cancer in their lives or families, but they know somebody who has a cancer. I feel the most important thing is to understand that you don't want to make that person feel any guilt about their cancer. Okay, that's the key thing. That's like what we talked about before. About how you deal with this is basically taking yourself out of the picture, reminding yourself multiple times that this is about the patient. It is not about you. It is not about your hospital. It's not about what you can do or cannot do. And sometimes it is not even about the parents. It is more about the patient. So getting back to that place where you kind of have the centered focus on the patient, and then being able to eliminate whatever your biases may be. When I say that meditation has helped me come closer to reality, is where what happens is that meditation has helped me get rid of some of the biases. And I'll share this in a simple manner, right? Let's say you had a bad experience with a patient, right? And then your next patient comes with a similar diagnosis or a similar kind of problem set. And would you change your practice just based on one bad experience? In an ideal world, you wouldn't, right? Because what you're practicing is evidence-based medicine. What you're practicing is based on thousands of patient data, not just one or two. So in a sense, you cannot let what happened with the yesterday's patient affect your treatment for today, right? At the same time, if you see a trend or if you see a pattern, then you should be able to pick up that trend. That's how the whole field of medicine advanced, that like picking up patterns and picking up trends, that, as simple as the story of the obstetricians and the hand washing thing, right? That's the simplest story kind of thing, like picking up patterns and picking up trends. So having that balance is what I feel is kind of helps us as physicians too. And as caregivers, I would extend this to caregivers, that sometimes the caregivers need to be reminded that it is not about you. It is about the person that you are caring for. And they may not be in a state of listening to you, but at the same time, you have to have that healthy space which allows you to maintain the objectivity of what you are suggesting, what you're doing, and the way you present your suggestions too, right? So all in all, I think the practice of meditation has helped me a lot throughout this process. And again, it helps more when I'm sincere with my practice. I want to be very humble that it's not always that I'm very sincere with my practice. And the reason I wanted to say that very truly is because sometimes it's a very obvious thing. We are with the, since like last few months, we are trying to grow a vegetable garden in our backyard. And we tried to do this few years ago, and it didn't work. It didn't work. We were not able to pay attention to the garden, and it didn't work. That time my daughter was like 4 years old, and I was doing this as a summer project with her. It didn't work, and so I was very hesitant to try it again. But we tried, and this time it really worked. Like it's working very well. And it wasn't always that it was working. What had happened is that we planted the seeds, and there were little saplings, and they were not growing. And it gets hot here in Southern California, so similar to India. The weather is similar. So what happened is one day one of the gardeners said, I said, what's wrong? I'm trying to work on this garden, and is it the soil? Do I need more manure? And what do I need? Like, why are these plants not growing? And all he said was, it just needs more water. And that was the simplest solution. I changed the time on the sprinklers from 5 minutes to 10 minutes, and the plants flourished. And so what I'm trying to say is that meditation is an effective tool. It works, but it only works when you do it. Right? It's like brushing your teeth. If you brush your teeth twice a day, it's going to help you, but it's going to only help you if you do it. If you say that, oh, I believe in brushing my teeth, but then you don't do it, just the belief in brushing your teeth is not going to work. And so I can see that when I've not been sincere with my practice, it has affected me. It is, and if you want to talk about the components of the practice, I think we could talk about a little bit about that too. Because when you think about the practice, there is the morning meditation and there's the evening cleaning, right? And both have a role to play, because it is not fair to my family that I am, kind of my occupation is being a childhood cancer doctor. Because if I'm carrying biases from my work and coming back to my family every day looking sad, then they're going to be like, what's wrong with you? Why don't you get a job at Disneyland instead? Disneyland is like very close to where we live, like it's half an hour away. So I've kind of thought of it sometimes that, instead of being a childhood cancer doctor, I should go work at Disneyland. So then that way I'll be a happier person. But the practice of cleaning is what helps there. that there are days in situations where, during my lunchtime, I would sit and do 10 minutes of cleaning. There are days when before procedures, I'll say a small prayer, and that changes the atmosphere. There are days when if there is going to be a family conference, which is going to be for an hour, hour and a half, that you go in a state of almost like what you do during meditation, where you go in a state of, you try to take yourself out of the picture, you try to invite the divinity in that moment, and you feel that way it helps the families, and it protects you also, right? So I practically, I don't think I could have done it without the practice. The burnout rate in pediatric oncology is quite a lot. I know a lot of my friends who kind of did fellowship and then started pediatric oncology practice, and then they stopped. They went ahead and did something else. They are working in pharma, or they went back to general pediatrics, or they're doing something else. So my point is that, we spend all this time receiving this training and being able to be effective in helping children with cancer. The same logic goes where we got to protect ourselves first, right? So, and protecting ourselves first, it's a very how do you say, there's a word inside my literature that talks about the I'm trying to not controversy, but invertendo. Invertendo. So it's almost like a process of invertendo, wherein you are trying to take yourself out of the picture, and that way you can help the family and the patient the most. So what I'm saying is, what you mean by you're taking yourself out of the picture is you're taking your biases out, you're taking your prejudices out, and you are having the objectivity and the strength to, one, decide what is right for the child and the family, and second, execute what you've decided is right. Because both are different things, right? Like, just like we said, meditation, you may decide meditation is good for you, but the execution of being able to practice every day is the key thing. I feel that way. Yeah.
One aspect which I feel we have not talked about yet are the kids themselves. What do you say to them? What do they say to you?
I feel all kids are special, not just kids going through childhood cancer. I see that all kids are special. It's almost like they come uncorrupted, and they are very special. And your job is to kind of uh, get out of their way, stay out of their way, let them be, let them grow. But at the same time, I feel like, just like the plants, they need the water, they need the love, they need the caring, right? So I'm not saying that negligence is the answer, like, okay, you say get out of your way, okay, be negligent. No, that's not the thing. They need the love, they need the caring, they need that. What happens with kids is that I try to joke a lot with the kids. I try to make it fun. Okay, and it's not because of I'm trying to deny or stay in a denial or something, but it's also because when you lighten the mood, it allows them to come to acceptance sooner. Kids know a lot more than we think they know. Kids are very perceptive, they are very sensitive. Sometimes I deal with parents and families where they say that, oh, we don't want to tell him, or we don't want to tell her that she has cancer. I don't think that works. I will always respect the opinion of the parents. It's not that I will do anything against their wishes, but I think the kids know. And if we are sensitive in the moment, then we know when the right time is to have the right conversation with them. The teenagers, like I said, they, will ask the question that, will I die? The shortest answer there is that yes, you may, and so will I. right? So bringing it to the framework that death is something that can happen to anybody at any time. We are not in control of it, how much ever we may think, whatever we may plan for. I mean, there is obvious things like, like now with the coronavirus, I'm saying like, you need to take care of yourself. You need to wear the mask. You need to avoid crowded areas. You need to not do crazy things. Just like when you're driving a car, you need to wear your seatbelt on. So there are things that you do. The vaccinations, like, there are things that you do to protect yourself. But at the same time, when you're talking to the kids, you kind of bring it to the level that this is something that can happen to anybody. And I'm saying this is more so with teenagers. With younger kids, they may not have an idea of it. But with the really young kids, you want to focus on making sure they're not suffering as much. Like there's not so much pain. So kind of trying to assess that how much, like, if they're in pain, then trying to make sure that you take care of that part elevatory. If they are having nausea, then making sure that you kind of take care of that part. We have very good anti-nausea medications now. So kind of making sure that they don't suffer. That's the focus there. Uh, the conversations are kind of direct. They're mostly straightforward conversations. And I think that allows you to respect the child. A lot of these kids sometimes are mature for their age. They are, I had one patient, she's doing really well. She was transplanted 4 years ago, and she was a little kid, but she used to watch all these old movies. And for some reason, like, her parents would actually say that, oh, she's an old soul, because she would love all these old movies, like the old classics and stuff like that. And so, again, not reading too much into it, but at the same time just playing with that. Like when I see a patient for the first time after I've talked to them, I kind of typically ask them, what's your favorite movie? And if I've seen that movie, like that, or if I've not, then I'll say, oh, my favorite movie is Kung Fu Panda. Have you seen that movie? So kind of it gives you an icebreaker, and then you can use analogies from the movie, from the sports area, to kind of bring them to, okay, what's your role right now? You you know a lot of times, in our lives, that's the key thing, right? Like, so you were a student and a child, but now your role is to be a patient. And so what's your role? What's expected of you, right? I think communicating that is important. And then the why. The most important thing is why, right? So and I'll use this analogous. One of the in the Heartfulness, one of the essays that I read from a teenager, this was an essay about character development, right? And so the young girl, what she'd written, right, she said, you don't think of character as a fence which kind of binds you, but think of character as a ladder. That if you stay within the bounds of the character, that it transports you from point A to point B. And so I use that a lot with my patients, that I'll say that, think about it, that you are going on a flight from Los Angeles to New York. And if you're going on a flight, you're going to trust the captain of the plane, and you're going to listen to what the flight attendant says. That, when they say fasten your seatbelt, that you're going to fasten your seatbelt. And you're going to do this because you want to get from Los Angeles to New York. So, and all of this is translational to the heartfulness practice, because in a sense, what we're trying to do through the heartfulness practice is, we're going to get rid of our biases. We're going to get rid of our prejudices. We're going to get closer to reality as much as possible. And when we are close to reality, we're going to have the strength to accept that reality, to be there, right? So it's like, the heartfulness guides, they talk about maintaining a condition. So what's happening is, in order to maintain a condition, just like in order to maintain your bank balance, you have to make sure that you get rid of your loans, you pay off your debt, and you have a steady income stream. Same thing with heartfulness. With the cleaning, you're getting rid of the samskaras or the impressions that you may have. And with meditation, you're kind of getting the necessary water without which the plants won't grow. Right. So I think for me, it has been a blessing because there's a tremendous overlap in my day job, which is basically taking care of children and families with cancer, and what I chose to volunteer as in the Heartfulness meditation. And it has helped me uh, when I have been less sincere that, okay, I need to get back to brushing my teeth twice a day.
No, but for us, it is really inspiring, Rishi, to see you put in all your effort and all your heart into trying to provide this cure for more and care for all those children and their families. How do you think we can, as individuals not directly related to the caregiving team of these children, do something for ensuring this care for all, not just for the children with cancer, but children facing all those challenges, uh, whether they are medical, whether they are emotional, and provide that kind of care and loving environment that can help them blossom and that can help them really prosper. Anything, any suggestions that you would like to give us?
So I feel like, again, the 9 o'clock prayer that is prescribed in heartfulness practice. Um, and I think I want to plug in, like, we have the International Peace Day coming up on September 21st. And I really think that I'm sure people who are listening will find details of the International Peace Day in the following days. But if you think about, like, it's not just one day, and if you think about the 9 o'clock prayer, the power of prayer is in not getting what you need or getting what you want. Like, I'm not saying that that's going to directly help the children get cured, but it's going to help in transforming the atmosphere. It's going to help in changing the environment. And what I feel, the reason this is true is because whether you are helping or trying to help a family going through cancer or any difficulty for that matter, sometimes it is not, they don't really need the direct help that they need, right? And to me, I learned this the hard way after being married for 12 years now, because my wife showed me a video of a young woman who, like, in the video it's funny, it's kind of, she has a nail in her head, and the husband is trying to tell her that, she tells the husband that I have a headache, and the husband is trying to tell her that, oh, it's because there's a nail in your head, and he is jumping to the solution part of it, but she needs him to be heard. So sometimes I feel like the families, the people, like, they just need to be heard. And if you kind of extend that, what does it mean to be heard? Okay, what does it mean to listen to somebody? It means that you are keeping, you are opening your heart, and you're creating an environment where the other person can express themselves. So the other way is, creating a environment which is safe for vulnerabilities to be expressed in that space. And the reason I say this is because often you may focus on, oh, this family is dealing with cancer, what can I do? You may go on internet and look up clinical trials or studies and come to them with, hey, have you tried this, have you tried that, have you tried this medicine? And again, have you tried this Ayurvedic medicine, have you tried this homeopathic medicine, have you tried this naturopathic medicine? And I'm not saying that that's wrong. Sometimes that's what may be needed, but think about it, that you may actually be causing more confusion and suffering for this family, right? Sometimes if they've chosen a path of a treatment path that they're going through, then they need to be compliant with that, right? Just like, you cannot wear a traditional Indian dress and a Western dress at the same time, right? Like, if you on any given day, you may wear one dress at once and you may wear another dress at another day. So same thing with the treatment strategies. You, and I'm not saying there are certain Ayurvedic medicines that have become a part of our leukemia treatments now. Like I'll give you an example. Arsenic is used in Ayurveda, and arsenic has become a part of treatment for acute promyelocytic leukemia, APML. And that has come through the channels, right channels, that has gone through clinical trials and stuff like that. So I'm not saying that there is not a room for all the alternative therapies, but what I'm saying is that the pathway is through clinical trials, through research, not anecdotal. And again, coming back to what the families need to do is that they need to respect that. Instead of, think about it, if you went to a restaurant and the waiter just brought in front of you like medu vada and dosa and chicken biryani and kept it on your table and said, okay, eat. Is that a nice experience? And the waiter in his heart is kind of being like, oh, I'm helping, this is a starving person, I'm going to feed him, right? So the approach is, if I'm a caregiver, if I'm a helper, if I'm going to help, then let me first come and listen. Let me ask, hey Gorakh, how hungry are you? What would you like to eat today? And then let me go look at my resources, what I have to offer, and whether that is a possibility or not. And if I cannot offer that, let's say Gorakh wants to eat, whatever soup, and I don't have soup on my menu today, then I should be able to point Gorakh to another restaurant that has soup, or another person that can bring him soup. And I think this framework is very important, whether you're a physician, whether you're a family, or whether you're, kind of whatever helper, caregiver.
That's a very important point that you bring up, Rishi, that where we probably need to connect to their hearts and really listen.
Yeah.
Give them space to express. Yes.
Yeah. And what I want to finish the loop is that I want to come back to the prayer, because what happens in the aspect of prayer is your focus is not the person, your focus is not the situation, your focus is not the problem that they're going through, your focus is not you and how you would be able to provide the solution, but your focus is the environment, your focus is the atmosphere, your focus is that, I am praying for the whole world. I am not praying for X, Y, and Z. I'm not praying for a particular country. I'm not I'm not geographically limited. I'm not limited by space. I'm not limited by time. Maybe what I pray for today may help the person 10 years down the line, who knows? So that I think is the most powerful thing, the prayer aspect of it. And I think that is something which will help everybody. Yeah.
So, would you like to take me and those who are listening along for a short session where we can pray together for the well-being of all the patients as well as all of us? Would you like to do that?
Sure. So what I would suggest is should we do like a relaxation and then, or we can just do a prayer, whatever. Yeah.
Something in my mind. Would you like me to do it for you?
Perfect. That would be perfect. Thank you, Gorakh.
Okay. So this is a process where, as Rishi says, the children, the families, and all of us, we all need to be listened to. We all need love. We all need affection. We all need respect. And I guess this is one thing that we can do at the very minimum. We are sitting in our homes, we can connect our hearts to all and send them love. I invite you to join us in this a very short session. If you're comfortable, we may all sit down, make ourselves comfortable. Gently close your eyes. Let your breathing be normal and calm. Relax. Gently relax your body. Your feet, calf muscles, legs. Let them all deeply relax. Feel your back muscles relaxing. Loosen your shoulders. Let your arms, palms relax. Let your jaw and face relax. Now with the body relaxed, gently bring your attention to your heart. Remember a person you deeply love, your child, spouse, parents, friend. Feel the love filling your heart. Let that love flow to the heart of that person. Include your family. Include your friends, your acquaintances. Each of their heart has the same loving divine principle. In all your hearts connected to each other in bonds of love. Let us remember children with cancer, their families, your heart send them lots of love. We are all on our own. Feel their hearts being filled with love and strength, courage, and peace. Let these bonds of love expand further and include all children. Their families. Are we not all bound together in this bonds of love? Deep in my heart, offer this prayer and feel that all their hearts are being filled with love. They are all developing correct thinking and right understanding. That real faith is going strong in all their hearts. When you are ready, come back to the present moment and gently open your eyes. What we did just now was a small heartfulness practice, which I am sure we all can take out time for maybe 5 minutes, 10 minutes, 15 minutes, and do our small bit for caring for all. If any of you would like to know more about heartfulness wellness initiatives, or if there is anything else that we can help with, in terms of answers, in terms of any support, please feel free to write to us at wellness@heartfulness.org. Lot of support systems are available for any of us who would like to explore heartfulness in depth. There is this Hearts app, which is a free mobile app for both iOS and Android, which you can use for guided sessions on heartfulness meditation. We have a wonderful heartfulness magazine that you can subscribe to. There are some wonderful guided videos and sessions on YouTube as well as on heartfulness.org. And of course, like this, we have some more webinars addressing various aspects of our lives in terms of our emotional health, our mental health, the medical challenges, the well-being of uh, a well-being glow webinar series, which is primarily for women, for work excellence. And I'm sure all of these webinars uh, can help us in these times of social distancing to come out stronger, to come out as a better human being with clear ideas and direction of how we each can go ahead to make ourselves and our society a better place to live. There are some other avenues where we can contribute in terms of financial contributions, in terms of our time, where we can volunteer to talk to or listen to people who need help. And of course, like what we did just now, we can let our goodwill, let our thoughts, let our love reach out. And as Rishi says, water the plants that need it. Thank you so much. Thank you, Rishi.
Thank you, Gorakh. Such a pleasure.
Eagerly looking forward to get in touch with you again.
Sure. Thank you, Gorakh. Thanks a lot.
Thank you. Thank you so much.